Hello everyone and welcome to today's presentation, which is part of a series of webinars provided by the Division of Public Health, Section of Chronic Disease Prevention and Health Promotion. Our section's vision is for healthy and safe Alaskans, and our mission is to identify and advance the conditions that lead to safe and healthy lives. The primary aspects of our work include health promotion, chronic disease prevention, and data collection and surveillance. This webinar series was created to provide a forum where we, as public health professionals, can have an open dialogue around specific projects and explore ways to collaborate. We will be offering webinars every third Tuesday of every other month at 1 p.m. In addition to sharing our work with you, we hope these webinars will spark your interest in learning more about our projects and explore opportunities for further collaboration. Another way you can stay connected to our work is through our monthly newsletters. You can sign up for the newsletter on the section's website. Our website address is at the bottom of all of our slides. There are a few housekeeping items to go over before we start. If you are listening by phone, please keep your phone on mute. Also, please do not put this call on hold. If you receive a call, hang up and call back in when you're finished. The webinar is planned for 30 minutes, a 20-minute presentation followed by 10 minutes of open dialogue. This webinar will be recorded and available online. All attendees should receive an email notice when the recordings are posted. A few more technical pieces. The audio for this webinar will come through your computer. Another option is to call the number provided. If you have technical difficulties, please let us know by using the question function on the GoToWebinar control panel. You can see a picture of where you would type it in there on your screen. You'll need a microphone on your computer, or you will need to call in the number provided to ask questions out loud. Please hold your questions until the end of the presentation. To ask a question, please raise your hand by clicking on the hand button in the GoToWebinar control panel. Again, there's a picture there of the button that you would push if you have a question to ask. With that, I will let today's presenter introduce himself and today's presentation.
Yes, my name is Charles Udemole. I'm a public health data analyst within the section of chronic disease prevention and health promotion. And today I'd like to introduce our Informed Alaskans initiative. And the easiest way to enter that is just go to your browser, type in Informed Alaskans, and then you'll immediately see the link. So from the Informed Alaskans, we are going to be using the AK IBIS, our Alaska Indicator-Based Information System for Public Health. So within the AK IBIS homepage, you're presented with three major tabs: health topics, indicator reports, and explore data sets. If you know what information you want, you could either go into the indicator reports, or if you're familiar with the data sets. But today we're going to presume that this is your first entrance, and here we're going to look at information by using the health topics menu. So within the health topics, we have a series of icons that have been organized into population characteristics, where we have both demographic characteristics and social determinants of health, risk and resiliency factors of both healthy behaviors and the physical environment, healthcare services and systems, both access to care and use of preventative services, and last, our health outcomes topics pages. For this demonstration, we're going to be addressing the topic of adult tobacco use. So we'll just click on tobacco, and this will bring us to a page of which it'll give us an overview description of what is happening, as well as additional information on why it's important, what is known about the topic, who is at risk, how to reduce risk, how is the measure tracked, as well as our data sources. So here we have, we can see that we have data sources from our indicator reports, queryable data sets, as well as our Instantatlas health maps. Since we're interested in adults, we're going to be clicking on this indicator to open our tobacco use among adults for the indicator of not smoking cigarettes. So here is our, you can see that we're on the indicator reports pages. And not smoking cigarettes is also one of our Healthy Alaskans 2020 leading health indicators. So you'll be presented with an initial overview of why is this important, as well as the relevant references that you can use. The other at any time you can turn on and off. You can toggle between that. The next major component that we have is an overview chart that tells you what's happening among Alaskans, Alaska Natives, the U.S., and then also our Healthy Alaskans goal. In this particular case, our goal is increasing the number of adults not smoking cigarettes to 83%. You can see that for the state as a whole, we're getting pretty close. We're approximately 80% right now. But among our Alaska Native subgroup, we still have a ways to go, where only 61% of Alaska Native adults, those individuals 18 years of age and older, currently do not smoke cigarettes. So, and we can see that these being survey data, we've provided you with the confidence intervals, and so you can see that there's significant difference between our Alaska Native adults versus the total Alaska Natives. And we can also see that Alaska is currently a little bit below the national trend of about 82% of adults nationwide do not smoke. So in addition to showing a chart, we always provide you with the associated data table. So we give you the indicator, the year, the prevalence rate, the upper and lower confidence interval, and then also the number of cases upon which these data are reported. Other important aspects that we have available are any data notes. Here you'll find some additional information on the source, any issues that are associated with it. Other information that is available from the indicator reports, we give you other views of the data, other indicators that might be related to this health condition, the definition, objectives, such as our Healthy Alaskans 2020 objective, our current outlook. This is where you would go if you wanted to find out how are we doing and how do we compare with the U.S. And then we also provide some health improvement resources. Here we explain what our programs are doing, as well as a listing of evidence-based practices that to address this concern of smoking. I should also mention that at any time at the bottom of any of our pages, we provide you with a telephone number and an email address. If for some reason the information being presented isn't meeting your needs, or if you have any questions, we encourage you to contact us directly. So here, earlier I had mentioned that we have other views. So by clicking on this, we realize that health is based upon a number of different conditions and situations. So we provide you analyses by a number of different subgroups of Alaskans. So we have it by sex, age group, race, ethnicity, marital status, education, employment, income, and poverty. After that, we also provide you some regional breakdowns of the information to assist in your community health assessments. So we provide that by Alaska economic regions or public health regions, metropolitan, micropolitan statistical areas, behavioral health system regions, boroughs and census areas, and tribal health regions. So here we're going to just look at by the 10 behavioral health regions. We've already seen this of why it's important, so we can minimize that, and so now we're presented with a table chart of the data. Here is our goal of our Healthy Alaskans goals of 83%. You can see that we're approximating that or exceeding that in a few of our regions. So we're right now Fairbanks overall, Fairbanks North Star Borough is currently exceeding. It just needs to maintain or exceed this rate into the future. But we do have other areas of the state which progress is still required. Again, we are showing data by all Alaskans and Alaska Natives, and you can see that in some areas of the state, the Alaska Native population is significantly lower. Again, at any time, we will always provide you with the associated data table so that if you need to transcribe it or put it into other documents. So this has been looking at our indicator report. If for some reason you want to take the information and let's say you want to provide testimony or you want to have the information in one location, you could always click on the full report, and this will summarize, provide you with a comprehensive listing of everything that is known on this topic, our definitions, how are we doing, what are the interventions that are possible. So you can just take this and print this off, and then you would have a complete resource guide. So now we're going to go back to our health topics. Clicking on tobacco again. And we've just been through our indicator reports for adults. So now we're going to be looking at using one of our queryable data sets. And in this example, we're using our Pregnancy Risk Assessment Monitoring System, or PRAMS. And we're going to be looking at individuals smoking now. When you enter the query system, we ask that you respect the privacy and not attempt to link these data with anything, the data, but just let you know that there are some usage constraints to these data. But we have also employed data suppression rules to protect the individual confidentiality of respondents. So here we're at the query menu. We could immediately submit the default information here by submitting the submit button. But in our particular case, we've noticed that there's been differences between Alaska Native and other Alaskans. So here we could either click on race, and we could select and filter the data by Alaska Natives, but here we're looking to do a comparison. So coming down to this step 4, we can specify that in addition to a breakdown by year, we would also like to see a breakdown by white, Native, and other racial classifications. We can also specify whether we'd like to see an associated chart. So we're going to put in here a horizontal bar chart, and then we're going to hit the submit button. And then the criteria that we've specified will now be used. So these data have now just been processed. Again, for recent mothers, we see that white mothers have much lower current smoking rates than do Alaska Native women. So here, even though they are significantly higher as denoted by the confidence interval, we are seeing indications that our health messages are making some, because we are seeing a beginning of a trend of reduced smoking among these Alaska Native women who have recently given birth. Again, you would always have our associated data table. So now we're going to, so now we've looked at both the indicator reports and our query system. So the last piece of evidence that is available to us is by looking at our Instantatlas health maps. And so for this particular, we've looked at our behavioral health systems regions before, so now we're going to look at current smoking, smokeless, using the Instantatlas application. This will take a moment to load because we're accessing a wealth of information. And within the application, we will be seeing a map of Alaska, a sorted bar chart. So here we'll momentarily see the map of Alaska, a bar chart sorted from low to high, and then an area that is showing us the time series for this indicator for the length of that the measure has been asked in our behavioral risk factor surveillance system. So this is the measure that's going to be displayed: tobacco use, current or smokeless tobacco user, and we're looking at it for overall for the period of 2014. That's what's being displayed in both the map and the bar chart. So here we can see that the highest level of 61% of current tobacco use occurs in the YK Delta, and then at the lowest is down here at 17% within the Matanuska-Susitna Borough. You'll notice that as I either scroll by the bars or on the map that we're seeing a purple line that is showing us the trend line for that region. Also, when we're just looking at when the data first comes up, we will provide you with the Alaska mean, the mean for Alaskan white adults, and then lastly, we also show it for Alaska Native adults. And so you can see that we have major racial disparity on this health measure of tobacco use, of 46% statewide among Alaska Natives compared to only 18% among whites and a statewide total of 22%. So, and if we wanted to change this, right now we're looking at total, we can just click our indicator in race, and instead of looking at all Alaskans, we can go in here and we can look at just information for Alaska Native respondents. We would select Alaska Native, select the current year, and now these data are showing for both the map and the bar chart are showing data just restricted to Alaska Native. So again, the highest region of the state is 73.5% of Alaska Native adults in the YK region currently are tobacco users, and for the data that are available, it's 26% within the Fairbanks North Star Borough. So this is how to get around our IBIS system. So we've gone over, you could either access the information via the icons under the health topics. If you familiar with the indicator reports, we give you options of either selecting it from a categorized indicator list. We have a number of different categories, as well as breaking out our Healthy Alaskans 2020 indicators. So you can see all 25 leading health indicators are currently represented in these indicator reports. Or if you've been here before and you know the name of your thing, you could just easily, quickly click on our alphabetical listing. And currently we have quite a realm of data out there. We have 74 current reports are there, and we've just recently released information on our adverse childhood experiences. So, and then if you are interested in exploring our data sets, you can select on our Explore data sets, and currently we have active our pregnancy risk management monitoring system, and shortly we will be providing data for both our BRFSS and YRBS data. So hopefully this has been a useful overview of the data, and now I'll open it up for questions.
Thank you, Charles. That was a great presentation.
Yeah.
Let me, excuse me for a minute while I switch us back over. I'm going to put down, we've got a resource slide here, and I'll get back to it in a minute. And remember, everybody, that we are going to send out a link to this recorded session afterwards, so don't feel like you have to scribble down these long web addresses as quickly as you can. You'll have them in a few days. And then just a slide with the reminders. We have 10 minutes left for open discussion. Again, we prefer, it's best if you can call into the line, and we'll unmute you. Everybody's automatically muted. If you're using your computer, we'll unmute you. You can ask a question, and we can discuss it, or you can give us your input, and we'll have a discussion about it. And if you can't do that, you can always type into the question box, and we'll get to you. So go ahead and open up. Go ahead and ask any questions you have. While we're waiting, I'm going to move back to the resources page in case people want to do that. I am not getting any questions at the minute, but I have a couple of questions for you, Charles. Can you, this is this is a huge, like really great statewide tool that people have. Who's currently using it? Like, who are some of your top users, and who do you think maybe would be, who's using it and who should be using it?
Well, it's getting an awful lot of use is those communities that are doing their community health assessments. We work very closely with the MAP communities, the mobilizing action through partnerships and planning. We work, one of our hallmark cases has been a map of the South Kenai Peninsula, which is making very good use of our BRFSS and YRBS data. So that's one of the reasons why we've really moved very much into providing the data at numerous geographical detail. Because these are survey data, we don't have information on most community. We cannot display information on most communities of the state due to the small sample size and the confidentiality concern. So we try and aggregate it into as small as our boroughs and census areas, and then we use aggregations above that up to our 7 public health regions. So we can display everything at an annual basis at our public health regions, our metropolitan, micropolitan, and then also those 10 behavioral health regions that I focused on earlier. When we look at finer levels of detail, our boroughs and census, and our tribal health organizations, we will use multi-year averages as needed.
And I'm sorry to even ask this, but I would think that people would be wondering, can you do a search by like a region or a community and have a summary of everything that we have about that in one spot? Or do you have to go into the individual ones and find what matches up best with your area?
We do have an ability that you can look at, if we go back into the Instantatlas, maybe I can just quickly go back into, open up our screen here. If we go into our Informed Alaskans, we do have data, and let's say most prominent is using at our adult surveillance system of the BRFSS. We have, and let's say we wanted to look at information for the tribal health regions. We can open that up, and then we do have data we provided, the single maps which I've shown before. We also have what we call our area profiles. And what this is we'll, instead of looking at a variable across space, here we can look at multiple variables within a given area. So here, as this opens, we can select, missing my cursor.
We got to swing way over here. There we go.
Oh, okay, excuse me. So here we can go up to our map, and let's say if we wanted to look at the interior, we could click on the interior, and then it'll be momentarily, we will have information on all of these different indicators for the interior. And what's most useful is generally probably not the demographics, but we do have other areas of the state. Here, let me. And so here's all of the demographics. We can scroll, but you would have access to multiple indicators here. Here we're gonna turn them all off. And then now let's say if we've been talking about tobacco use, so now we can just highlight all the risk factors for tobacco use within the interior. And so here you can see what the prevalence rate for all Alaskans, white Alaskans, and then Alaska Natives within the interior region, and then all of the other indicators that we have for related to smoking. So this is a good way for assisting communities for prioritizing what interventions and what do they want to focus upon. So,
Oh, yeah, great. We do have one question. Linda Brown asks, she typed it in, how do we know what region we are included in? Sorry, I missed the first few minutes. No, this was not explained in the very beginning. So how do they know what region they're included in? And also, are we in the same region across all data?
okay.
Good
What we
questions.
do is that if we go back, is we do have some geographic descriptions. So what I would say, you can go in, not knowing what area, let's say if she wanted to find herself within the public health regions, she could click here. We're now at the geographic descriptions. We can go into the public health regions, and then she would be able to find out. Hopefully most Alaskans are familiar with what borough or census area that they're familiar with, and then this way will allow them to see. I'm unfamiliar with her contact information, but here she can see if she's, let's say, a member of the Ketchikan Gateway Borough, then she would be looking for data within the southeast region. And she could find that for any of the other geographic systems that we have. Like I say, the most ones that we're really gearing toward reporting on are these new behavioral systems regions. These are groups of the state that are of 20,000 and more population. So they're relatively good aggregates, but it's dividing the state into 10 units, which has been much superior than our old, what we used to call our 6 public health or economic regions, because now we can get down into subdividing our rural component of the state that was previously combined.
Great. And I just want to point out to Linda and everybody else, I believe our contact information is attached to almost every page we have. You can get lost pretty quickly sometimes when going through this, so we're happy to help you out if you're looking for answers to questions like this. Feel free to call our office if somebody can answer that question.
And yeah, and I should also mention, usually at the bottom of each page or on each page, you'll see like a Get Help, which will have our contact information. So the main thing is that we're trying to really assist people in using these data. And do not hesitate, if you don't find it on the web, to give us a call. We provide both our telephone number as well as an email address. And we are also available to give individual and group training in this resource.
All right. Any other questions? I don't see any coming in by phone or by the computer, and I don't see any others typed in. Any in the room? I'm seeing all heads shaking no, so I think we'll leave it off there. Charles, thank you very much for a great presentation. Thank you all for who attended today. Please tune in again in July for the third Tuesday of the month. I had to make sure I was saying that right, for our next webinar, and just keep your eyes out for the next announcement. Thank you very much.